Okay, this is the last video. It's new parent teaching. Our topics for discussion are safety, bathing, dressing, cord care, fingernails, circumcision care, comforting a fussy infant, car seat safety, and when to call the doctor. We'll also include a section on things that don't look normal but are totally fine. Safety, safe sleep, always on the back, never on the side, never on the stomach, always on a firm crib mattress. You can even use a cardboard box with a crib mattress. We did it at Temple not too long ago. Um, I think they stopped that program because people stopped giving them money for it. But a firm mattress does not have to be a fancy bed, but it does have to be firm and it does have to fit the bed so that the baby can't slip between. No extra bedding, no pillows, no comforters, no bumper pads, none of that fluffy, fun stuff. Really, whatever they're wearing or swaddled in a crib sheet is all they need. They do not need anything extra. Babies should never sleep in a recliner or an adult bed or in a twin bed, anything like that. It's not safe for them. And discourage bed sharing. Some people are really into co-sleeping. It's not safe. Parents can roll over children, and particularly if there's any alcohol use or medication for sleep or anything like that, siblings have rolled over on babies, and then it's a tragedy. Preventing newborn falls. Okay, we talked about this a little bit. Protect mom's sleep. Side rails up. I love this picture because mom's got her side rails up. And that way, if she gets sleepy, she's much less likely to let the kid go all the way to the floor. Keep a night light on. That'll keep mom sleeping a little bit later, and it'll help the nurse kind of take a peek in without disturbing mom and see what's going on. And another thing to prevent newborn falls. Most falls that happen, like I said, it's that exhausted C-section mom who has been up for 2 or 3 days. Her visitors keep coming and going, and she's not getting any rest. And then all of a sudden, it's 3 o'clock in the morning. She's hung on as long as she could. She maybe takes a Percocet because she's in pain, and then boom, the kid hits the floor. So if mom is really that tired, it's okay for us to take the baby for a little bit for a break. Other things about newborn falls: babies can roll off unstable surfaces, so they should not be left alone on an adult bed or on any other surface that is not a safe sleeping surface. Okay, more on safety. Tell the parents that people should not come to visit them if they are ill. Anyone with flu-like symptoms who is not actually in the hospital to be treated for the flu should not be there. Hand washing, they should be using either the hand sanitizer at the door or soap and water before they enter the room. Do not let anyone touch your baby before they wash their hands. And that will prevent infection. In terms of choking or gagging, some kids are just, they're mucusy or they spit up a little bit. Most of the time, they'll turn their head to their side and clear their own airway, but it makes moms and dads feel a lot better if you show them how to use the bulb syringe. So, just to very briefly go over this, you squeeze the bulb before you put it in the baby's mouth. Put the syringe in the side of the baby's mouth, like in that pocket between the cheek and the gum, and then suck out all the stuff. You let the bulb go back to its normal shape and it'll create that suction and get that stuff out. And then you can squeeze it into a tissue. You don't want to go straight back because you'll gag the baby and that'll just make your problem way worse. And if your baby's a spitter, I encourage you to position your baby upright after feeds. Burp them really well. And keep them on your shoulder for a little bit longer, for maybe 15 or 20 minutes before you put them down. Other safety things we already talked about: transporting the baby in the crib when in the hallway, and don't release your infant to staff who is not appropriately identified with a maternity-specific badge in the hospital. Now, bathing, dressing, diapering. We already talked a lot about how you're going to give the first bath with the mom and dad. Now we're going to talk about how you teach mom and dad to do it. So you're going to teach mom and dad sponge baths until the cord stump falls off. After that, it's safe to immerse them in like a tub of water as long as you're there constantly. Babies can drown in an inch of water. You never want to leave the baby alone. Make sure you have a warm room. Make sure you have all your towels and soap and washcloths and anything you're going to use ahead of time, because you can't leave the baby. Even if you're doing a sponge bath on a changing table, you can never leave a baby alone on a surface. That is not a safe sleep surface. Dress that baby in one more layer when you're all done than what you're comfortable wearing. So if it's August, you don't have to bundle a baby in like 14 layers of clothing and a big Afghan. In fact, that's a risk factor for SIDS. So we don't want to overheat our babies. They can't sweat, so they can't regulate temperature, but they're not active, so they do need that one more layer. So whatever you're comfortable in, plus whatever you're going to swaddle them in, is fine. In terms of diapering, diapers are pretty easy, the disposable diapers. There's a back and a front, and the back is usually where the tabs are, and most diapers have cartoons on the front. It's kind of neat. The ones in the hospital have that yellow line that turns blue when they pee, because sometimes meconium can obscure that. You're going to demonstrate it once, then get them to teach it back to you. They can call you into the room every time, but what you should not be doing is changing that baby for them every single time. You should be letting them demonstrate confidence. They'll feel more confident because they're going home with this kid and you're not. Teach moms, especially moms of boys, or actually teach any caregivers, not specifically moms. Anyone who's going to change that diaper, especially with boys, you want to work fast or be prepared to do lots and lots of laundry, because they will make a mess very quickly. That cold air hits them and there they go. With girls, we always want to wipe front to back to prevent the spread of infection. Baby girls do get urinary tract infections from time to time, so we want to teach moms and dads proper hygiene. Cord care. So we used to teach people to do all kinds of things. We used to do all kinds of things to the cord. Triple dye and ointments and alcohol. And we don't have to do any of that. AWON studied it maybe 10 years ago and said there was no benefit whatsoever. Just keep it dry and out of the diaper. As far as fingernails go, those little fingernails are paper thin and so sharp. And they do tend to, because of the feeding cues, when they try to get their hands to their mouths, they do tend to scratch their faces. So you want to use mittens or little cuffs that fold over. Or if mom or dad or whoever really wants to trim those nails down, do not use clippers. Use a little emery board, one of those little boards that you use for manicures. It's painstaking, it's slow, but it will prevent injury. All right, circumcision care. We talked about what a circumcision was and what your role is in it. If that baby had a circumcision with Mogan or Gomco, and that's the most common type, you're going to teach the parents to change the diaper. Every time they change the diaper, they should be covering the penis with a gauze square, or, as this very crafty lady found, a makeup pad, a clean makeup pad, smothered in Vaseline. You want a lot. Goop that thing up as much as you can with Vaseline, and that will keep the penis from sticking to the diaper. It'll keep the urine from stinging the site of circumcision. We're going to teach parents to report bleeding that is more than a quarter, and of course, any signs of infection. What is not a sign of infection are the yellow crystals that cover the glands of the penis as that site heals. That is granulation tissue. It's just how that wound heals. And you're going to teach them to call if the site looks more red or swollen, if it has a funky smell. Anything that has a funky smell warrants a phone call, or if the baby can't void. Sometimes there's a little strip of gauze that's impregnated with petroleum jelly. The OB puts it on. It usually falls off on its own. And if it doesn't, you can goop it up with lots of Vaseline and take it off yourself. The Plastibell falls off on its own, doesn't need any special care, so that's that. Now we're moving on to car seat safety. Car seats are maybe one of the most important things that you can teach a parent. And yet some facilities have a weird policy that we're not allowed to explain car seat safety. I've seen 2 hospitals like that, and other hospitals will have a video with, they want consistent knowledge, so it's approved, or they'll have certified car seat technicians. People on staff usually will go get the training. Car seat must be the correct size for a newborn. Check the box. If it says, 10 to 20 pounds or 10 to 40 pounds and your kid is 6 pounds, it's not the right size. It can be either one of these that has the handles. Those are the common ones that snap into a base. They also can snap into a stroller, and mom can carry it, or whoever can carry it by the handle. Or they can be a convertible car seat. It does not have a handle. It will convert to like a car seat that's appropriate for toddlers. Doesn't matter as long as it's approved for that baby's size, it's okay. You want to have them rear facing in the back seat, and they're rear facing now for at least 2 years. You'll learn more about that stuff in peds too. Watch the buckle. Okay, see this picture right here. I wonder if I can, no, I'll probably just change the slide if I do that. Okay, you can get my pointer. This here is fine. The top of the buckle is at the level of the armpit. The bottom of the buckle is usually between the nipple line. That's where you want it. That's protecting the sternum. So if the baby is in a car accident, or if the car is in a car accident and the baby is sort of thrown, you want to make sure that that buckle isn't all the way down here or by the belly button, because the baby's shoulders are little and they can slip right out and that baby goes out the window. You want no more than 2 fingers between the baby and the straps. So get your fingers in there and make sure it's tight enough. Some parents will get very upset because they think you're hurting their baby. Well, it hurts a lot more to be thrown like a projectile through a car window. Of course, you can't say that out loud. You can just think it. But you want to make sure that those straps are nice and tight. To that end, you want to make sure no snowsuits, no bulky jackets under the straps, nothing puffy or bulky, no whatever. You put the baby in the car seat first in their clothes, and then you can put the blankets, the snowsuits, the jackets, whatever, around them on top of the straps. They don't have to be wearing them for the, to stay warm, but they do need to have those straps snug. You want to make sure that it's installed correctly in the car so that it's level. There's usually a little indicator over here, like a little ball, and you want to make sure that it's level because you don't want them reclined too far or upright too far where their head would tip forward. Head tipping forward can cut off their airway. If you need to position receiving blankets on the sides or a little positioner for the head to make sure that their head stays in alignment, that's appropriate. And you're going to anchor it with the tether and use the base and all the things that the car seat manufacturers recommend. Okay, so our last 2 slides, things that look weird but are perfectly normal. Spitting up after feedings, totally normal if it's just a dribble and it's a little bit, especially if it's full of mucus. Parents get freaked out, but it is not truly vomiting, it's just overflow. Mushy poop, perfectly normal. Not diarrhea, it's because they eat a liquid diet. I kind of almost want to go duh. But as long as it's not watery, like transparent, where it looks almost like a stain on the diaper, then it's not diarrhea. It's just, that's what it is. It's that consistency. It starts off sticky and tarry and it gets to mushy and stays that way until they eat solid food. Pseudo menstruation, that drop of blood in the diaper, perfectly normal. Freaks parents out, but it's okay. Mucoid discharge in girls. See that all the time and it's fine. Yellow crystals on a circumcision site. Again, signs of healing. Newborn rash, talked about that extensively. Milia, those little white dots that go across the nose and cheeks. Periodic breathing, that breathing really fast and then taking a pause and then going back to another breathing pattern, that's normal. They're new at it. Hiccups are perfectly normal. Sneezing is normal. It's how they clear their nose, which is their obligatory airway. The startle reflex, that Moro reflex. He's shaking. No, he's not cold. It's the Moro reflex, and it's normal. The dried up cord stump looks like a raisin. Is it supposed to look like that? You will spend a lot of your day if you work on mother-baby units telling people that everything is normal, and they don't believe you. They'll tell them to Google it because it is. It's totally normal. Molding and caput, babies' heads look weird. They just do. Goes away. They'll have normal heads again someday, but it's normal. And Mongolian spots, we've already talked about them. Now, what isn't normal? What is a big old red flag? Well, it may sound obvious to you, but people need to hear it. Call 911 if your baby turns blue or stops breathing. If your baby has a seizure. If your baby is not responsive, they don't wake up to stimuli. You tap their feet and they don't wake up. Even if they're breathing, call 911. Like I said, it might sound obvious to you, but people need to hear it. Call the doctor if the baby is crying inconsolably, particularly if it's like a really shrill, high-pitched cry, that means something's going on. Even if it ends up being just colic, just call. That's what they get paid the big bucks for. If your temperature is 100.3 axillary or higher, you are going to make a phone call, or mom is. You're teaching mom all of the things that I'm saying. Projectile vomiting. This isn't that spitting up through the corners of the mouth. This is like projectile vomiting and they don't hold anything down. If they refuse to feed, if they are lethargic, and by this I mean they sleep too long and their tone is poor, they're kind of limp, and they just don't act right. If they're not wetting 5 or 6 diapers and soiling 5 or 6 diapers a day once the mature milk comes in for a breastfeeding mom, and pretty much after the first 2 days for a bottle feeding mom or formula feeding mom. If they start to look yellow or orange, you need to call the doctor. That's a sign that maybe that baby is getting jaundiced. And if you have any problems with the circ site, these are the reasons you would call the doctor. And that is the end. Thank you very much.